This session will help educate counselors and pastors about the medical consequences of worldly sexual choices. And as a family physician, I have the unique privilege of helping patients navigate these difficult consequences of poor choices. And although as pastors and counselors, you may not be treating these medical conditions, you will be involved with the people that will be suffering the emotional and spiritual effects of poor sexual choices and the consequences associated with them. You may be the one who suggests that a counselee needs to see a physician. And overall, I think it's important for pastors and counselors to be prepared to speak with an accurate and expanded knowledge base. You're not expected to be an expert, but the more you know, the more you'll be able to help people get help. And similarly, even as a physician myself, especially as a family physician who sees a multitude of medical problems, I don't pretend to be an expert in any one area. But with an expanded knowledge base, hopefully I'll better know what I know and don't know, so I can refer patients to specialty physicians that are most appropriate for their needs. So, as we embark on being made more aware of these topics, I'm reminded about verses of needing God's wisdom, both to have understanding about these difficult consequences of sex outside of God's plan, but also to have God's wisdom in how to interact with those in our counseling spheres who are dealing with these issues. So from James 1:5, if any of you lacks wisdom, let him ask of God, who gives to all liberally and without reproach, and it will be given to him. And specifically in counseling parents and families in these situations from Proverbs 24:3, through wisdom a house is built, and by understanding it is established. So in discussing God's view versus the world's view of sex, let's start with definitions about the purpose of sex. God's view of the purpose of sex is procreation and facilitation of unity in a lifelong commitment of marriage between one man and one woman. This fosters a secure and nurturing environment for children and reflects the unity of Christ in the church. From Genesis 1:27-28, so God created man in his own image. In the image of God he created him. Male and female he created them. Then God blessed them, and God said to them, be fruitful and multiply. And from Genesis 2:24, therefore a man shall leave his father and mother and be joined to his wife, and they shall become one flesh. This is so important that Jesus repeats these sentiments in the New Testament. It's not just outdated edicts from the Old Testament. From Matthew 19:4-6, and this is Jesus speaking, and he answered and said to them, have you not read that he who made them at the beginning made them male and female, and said, for this reason a man shall leave his father and mother and be joined to his wife, and the two shall become one flesh? So then, they are no longer two, but one flesh. Therefore, what God has joined together, let not man separate. And Jesus' words are recorded similarly in Mark 10:6-9. And modern society tries to say that Jesus was all about love, which is true. But these same people try to paint Jesus as being tolerant and forget that Jesus himself repeats commands of importance in the Old Testament. The marriage covenant and purpose for sex was important, outlined from the beginning in Genesis, and Jesus repeats this. Then Paul, under the inspiration of the Holy Spirit, also speaks of God's purpose for sex and marriage, and further expands that relationship mirrors Christ in the church. From Ephesians 5:31-32. For this reason, a man shall leave his father and mother and be joined to his wife, and the two shall become one flesh. This is a great mystery, but I speak concerning Christ and the church. In addition to union and procreation, sex God's way is pro-erotic love. It's not just a boring duty, but meant to be a blessing and satisfying expression of love. From Proverbs 5:18-19, let your fountain be blessed, and rejoice with the wife of your youth. As a loving deer and a graceful doe, let her breast satisfy you at all times, and always be enraptured with her love. Yes, God talks about these intimate things in his word. His purpose for sex is good. And as a physician for 20 years, I've had the privilege of hearing about the sex lives of many patients behind closed office doors, and all confidential, of course. I'll hear of the difficulties with sexual enjoyment, physical difficulties, and inquiries into the lack of sexual orgasm. And as a whole, from my experience, the people having sex within God's confines are having the best sex lives. And those who've had sexual pasts steeped in sin are the ones who are struggling. It's no surprise that God is true in his word, but it's really true from behind hushed doors in the medical office. The world may make sex look enticing, but in the end, the world's view is evil and not fulfilling. God's way is best, and I can vouch for that by those who tell me so. The world's view, purpose of sex, is pursuing sexual desires governed by personal sexual fulfillment. It's not for another's satisfaction or being in unity, not for procreation, not to mirror our relationship with Christ, but for self. And it's no surprise that the world's way for sex leads to unwanted pregnancy, consideration of abortion, STDs, violence, adultery, homosexuality, bisexuality, transgenderism, bestiality, and any other perverted form of sexuality rooted in evil and selfish desires. Love outside the marriage covenant is inherently unsatisfying. Thus, this leads to perversion to make up the difference. So God outlines in his word the purpose for sex. What does he say about the world's view of sex? From Hebrews 13:4, marriage is honorable among all, and the bed undefiled, but fornicators and adulterers God will judge. So sex outside of God's plan is serious to God, and he will judge. It was serious in the Old Testament. How did they judge adultery and fornication? From Exodus 20:14 and Deuteronomy 5:18, it says, "You shall not commit adultery." And the punishment for adultery was serious, stoning, leading to death in the Old Testament. From Deuteronomy 22:20, "If evidences of virginity are not found for the young woman, then they shall bring out the young woman to the door of her father's house, and the men of her city shall stone her to death with stones." And some say again, well, that was just in the Old Testament. But Jesus, the one who loves, took it further and explained that adultery of the heart was just as bad. From Matthew 5:27-28, "You have heard that it was said to those of old, 'You shall not commit adultery.' But I say to you that whoever looks at a woman to lust for her has already committed adultery with her in his heart." So the actual consequences may not have seemed just as bad as stoning, but is still bad with the true state of one's heart. Jesus didn't dismiss the Old Testament as outdated. He verified the validity and took it even a step further so that no one would think that they were innocent of the temptation to sin with God's good intentions and plan for sex. Paul further expands on this from 1 Thessalonians 4:3-8. "For this is the will of God, your sanctification, that you should abstain from sexual immorality, that each of you should know how to possess his own vessel in sanctification and honor, not in passion of lust, like the Gentiles who do not know God, that no one should take advantage of and defraud his brother in this matter, because the Lord is the avenger of all such, as we also forewarned you and you testified. But God did not call us to uncleanness, but in holiness. Therefore, he who rejects this does not reject man, but God, who has also given us his Holy Spirit." At the end of that verse, it's summarized that those who follow uncleanness sexually and not holiness are rejecting God. We sinfully want to put God into a box that goes along with our views, but we need to submit to what he says, not letting our sinful views of sexuality direct our views of God. As said by Dr. Andre Van Mol in 2001 in Today's Christian Doctor, are you allowing God to direct your sexuality and how it is expressed? Or are you allowing your sexuality to direct your view of God and the Christian life? He goes on to say, "Is your chief concern how quickly you can push aside Scripture to get on with your intentions? Are you simply trying to generate a theological case for behaviors you have already determined in your heart that you will act upon?" Quite poignant. Do we listen to God in his ways, or do we make him who we want him to be through our own sinful and inadequate frame of reference? Do we really think we know best? Unfortunately, we do, which is why we sin and refuse to surrender to God in his ways. So now that we've reminded ourselves from God's word about his warnings about sex outside of the plan of marriage, let's dig into those consequences that I've been alluding to. Pregnancy. In 2015 in Montana, 46% of high school students reported having had sex. The United States has the highest teen birth rate of any industrialized nation. The average first age of intercourse for males is 16, for females is 17, and 50% of teen pregnancies occur within 6 months of having sex. Obviously, it only takes one time, but usually within 6 months, they'll be at risk of being pregnant. Pregnant patients younger than 17 have higher medical complication risks than older patients. They'll have low birth weight of babies and death rate of newborns that are 3 times higher. Maternal mortality, which is mother's death through complications of pregnancy, is 2 times higher. Prematurity of the infant, pregnancy-induced hypertension, anemia, sexually transmitted diseases, substance abuse, poor nutrition, as well as psychosocial problems such as interruption of school, limited vocational opportunities, children with higher risk of developmental delays, behavioral disorders, academic difficulties. 50% of unintended pregnancies occur among women using contraception, and it's because inappropriate use and not adhering perfectly. Obviously, it's easy to misuse barrier methods like condoms, tearing, not getting them on in time. Several hormonal methods have ethical disadvantages regarding their mechanism of action, which is how they work. The most effective is combination estrogen-progesterone pills, but they're still risky if a teen misses pills, takes antibiotics while they're on the pill. The meds are not always safe. They have side effects, blood clots to the legs, lungs, worsened moods, including suicidal ideation, risk of stroke being on birth control, weight gain, breast cancer. The only true pregnancy prevention is abstinence. And to avoid pregnancy, some teens will experiment with sexual practices such as oral and anal sex. They think they're preserving their virginity with these alternatives. They might not get pregnant, but they're at serious risk for sexually transmitted diseases. May acquire chlamydia of the throat or precancerous genital warts of the anus. And obviously, it's disgusting and heartbreaking to think of teens engaging in these physically risky behaviors, but not to mention the emotionally risky consequences of treating these acts as if they're preserving virginity. It's sickening when a child's heart is obviously not being protected with these alternative sexual practices. And since the heart isn't protected and these teens are not honoring the Lord, 50% of teens engaging in these behaviors are having vaginal intercourse within 2 years. Sexually transmitted diseases. There's 20 million sexually transmitted diseases each year in the United States, and half of those occur in adolescence. The new terminology is STIs, politically correct infections, rather than the dreaded connotation of disease, similar to lepers in the Bible. Yet infection does teens a disservice and conveys that an infection can easily be treated with a simple antibiotic, but many sexually transmitted infections are not cured by a course of antibiotic or medication, and the complications and risks can be lifelong. HPV, human papillomavirus, this causes cervical cancer and genital warts, and it can also cause less common cancers of the vulva, vagina, anus, head, and neck. The virus is spread by skin-to-skin contact, including intercourse, yet also any other contact in the genital area, so close sexual contact can spread HPV. Condoms do not provide complete protection because condoms do not cover all exposed genital skin. HPV can resolve on its own, but oftentimes it persists indefinitely in a hidden state and risks causing cervical cancer 20 to 25 years later. The PAP component of PAP pelvic exam checks for cells of the cervix, looking for any cancerous or precancerous changes. And often we'll think about cancer in a 90-year-old grandpa or something, yet women with more than one sexual partner are at risk for cervical cancer in their 20s and later. There's a Gardasil vaccine for females and males, age 9 to 26, that helps decrease risk of HPV, but it's only about 75% effective. Many other strains have not been detected, which further just emphasizes that we cannot get around God's warning and the recommendations for safeguarding sex between one man and one woman. Since there are several HPV strains, it's still worth getting the vaccine, even if someone's had sex, just to protect from other strains with the next sexual partner. And there is some evidence that receiving the vaccine earlier provides better immunity. I strongly recommend the Gardasil vaccine standardly at the age 11 to 12 well-child exam with preteens. I definitely recommend it by the mid-teen years. And I discuss the vaccine and its purpose in detail with patients, with the 11 to 12-year-olds, and with their parents. And I emphasize this does not give the teens license to have sex because it's only 75% effective, and obviously there are many other risks with sexual intercourse. But receiving the vaccine will be protective for whoever their future husband and wife may be. I encourage and cheerlead that patient to remain a virgin and hope that their future mate will be a virgin as well. But if the wonderful person that God has chosen for that teenager maybe became a believer in college, had a past in high school, receiving the vaccine would protect that child against cervical cancer and genital warts later if their future spouse had a sexual past. HSV, herpes simplex virus 1 and 2. Herpes type 1 is the virus that causes common cold sores around the mouth, lips, and nose. And this virus can be spread through innocent means, maybe just a kiss from grandma. The virus stays hidden, so it can spread even when someone doesn't have an obvious cold sore. But once you have this virus, you're at risk for flares of cold sores your entire life. So further incentive for kids to not give in to casual kissing and increase risk of getting cold sore virus. Herpes type 2 is the virus that causes painful ulcers and blisters on the genital region. And 1 in 5 adults has this virus, but many with no symptoms, so they don't even know they're infected. Once someone has their first outbreak, they will have severe and recurrent episodes of genital ulcers for years. The infection stays in the body forever in a latent form in the nerves and manifests with outbreaks during times of physiologic stress. Women who have an outbreak of genital herpes when they're pregnant and ready to go into labor have to have a C-section due to the fetal risk of herpes encephalitis, a severe and life-threatening brain infection to the baby. It's difficult to determine where the infection came from. If someone's had multiple sexual partners, the virus can stay hidden for years and then cause an outbreak. Thus, oftentimes, the current sexual partner is not the cause of the outbreak. It can be diagnosed with a culture test, but oftentimes this only diagnoses it 50% of the time. Sometimes it will say it's negative, and yet it still could be herpes. You can have a blood test that shows whether you have antibodies to HSV1 or 2 that will show whether you've been infected at some point in the past, but it doesn't say when. So the antibody also could be negative within the first few weeks of a new exposure. And antiviral medicines can keep the symptoms under control and prevent spread, but does not cure. Chlamydia gonorrhea infects sex organs, the urethra, throat, rectum. In women, causes vaginal discharge, abnormal bleeding, abdominal pain, pain during intercourse and urination. In men, causes penile discharge, painful burning with urination, pain and swollen testicles. And in women, if untreated, can lead to pelvic inflammatory disease, scarring the fallopian tubes and causing risk of future infertility. Leading untreated can lead to joint infections and arthritis. Trichomoniasis, some have no symptoms, so it spreads really easily in people who think they're quote-unquote clean. In females, it causes a foamy greenish-yellow discharge, which is itching and painful with urination. Syphilis, symptoms start 2 to 3 weeks after infection. You get raised red bumps on the genitals, turns into an ulcer, not painful, so a lot of people don't get treatment. Then weeks later, it leads to a widespread rash, fever, headache, swollen glands. Tertiary, late-stage syphilis can be present for years without knowing it and turn up later in the brain and cause vision changes and confusion that mimics Alzheimer's dementia. Pubic lice, which is also called crabs, causes itching, spreads easily on clothing, bed sheets, towels, can easily get transmitted to the armpits, eyelashes, eyebrows. Hepatitis B and C, these are blood and bodily fluid-borne infections of the liver that can be life-threatening. Treatments have varying success rates and sometimes ultimately requires a liver transplant. Hepatitis B can be prevented by routine childhood vaccination series, but there's no vaccine for Hep C. And many inappropriately forego the Hep B vaccines for their teenagers, not understanding that Hep B can also be transmitted not only sexually, but via blood or bodily contact with other fluids, such as needles on a medical youth mission trip, tattoos, IV drugs, oral bites in a nursery setting. And then HIV, which was initially most prevalent in the homosexual population, but increasingly seen in all populations. So, sexually transmitted diseases, you know, there can be lifelong consequences. It's not just a simple, take a pill and you're fine. Teen dating violence, and I acknowledge that violence can occur in any relationship, but I'm highlighting teen violence since those having sex under age, the typical age of marriage, are very susceptible to this risk. The highest rates are in women, ages 16 to 20. 2011, 9% of high schoolers reported some type of physical violence in relationships. And certainly it's more common in teens involved in other risky activities such as drugs and alcohol. And all you have to do is read the local paper in Bozeman here. Sometimes it's affiliated with college parties where date rape drugs can be slipped into drinks. You know, even if the teenager's a designated driver and they're not drinking alcohol themselves, a drug could be slipped into their Coca-Cola and then be at risk for violent rape. So it's really important encouraging teens not to be in an environment of drugs or alcohol, not ride in a car, go to a home where that's going on. And if they think they're innocently going to a friend's birthday party and then they find themselves in a compromising situation at a friend's home, Certainly encourage kids to call, have their parent pick them up at agreed upon location. If the teen is uncomfortable, they should be encouraged to leave and feel honest or feel able to honestly call their parent for help. All right, now we're going to switch gears from the risks of premarital homosexual sex, heterosexual sex, with unwanted pregnancies, infections, violence, and discuss homosexuality as another view of sex from the world's perspective, not God's. And I acknowledge that this is a difficult topic, not politically correct, yet God is clear in his word, his stance on this topic, both from the Old and New Testaments. From Leviticus 20, verse 13, if a man lies with a male as he lies with a woman, both of them have committed an abomination. They shall surely be put to death. Their blood shall be upon them. Again, similar to the adultery, there are serious consequences. Be put to death. It's not a simple infraction with no punishment, but it's serious. And Leviticus 18:22, you shall not lie with a male as with a woman. It is an abomination. Nor shall you mate with any beast to defile yourself with it. Nor shall any woman stand before a beast to mate with it. It is perversion. Do not defile yourselves with any of these things. For by all these the nations are defiled, which I am casting out before you. And it's interesting to note that homosexuality is described right next to bestiality. Most in our culture would agree that bestiality is wrong, yet we can't see that homosexuality is wrong. In God's eyes, it's in the same paragraph in his word, yet our culture has convinced us that it's okay to choose who you love, even if God prohibits it. Again, many try to claim that these verses are outdated Old Testament commandments, not applicable to today's society of acceptance and tolerant love. Yet we're reminded in the New Testament of these same warnings against homosexuality. It's clear in God's word that he takes seriously the things repeated in the New Testament so that we have a clear understanding of his ways. From Romans 1:26-32. For this reason, God gave them up to vile passions, for even their women exchanged the natural use for what is against nature. Likewise, also the men, leaving the natural use of the woman, burned in their lust for one another, men with men committing what is shameful and receiving in themselves the penalty of their error which was due. And even as they did not like to retain God in their knowledge, God gave them over to a debased mind to do those things which are not fitting. Skipping down to 32, who knowing the righteous judgment of God, that those who practice such things are worthy of death, not only do the same, but also approve of those who practice them. Yikes. Worthy of death, not only do the same, but also who of those who practice them. There's a reason we're not to be tolerant. Being tolerant means that we approve, and then we're guilty of the same judgment of God. And yes, through Christ, we are covered by his righteousness and will not be judged eternally for our desperately wicked, sinful state, but we're still called to go and sin no more. We're supposed to be growing in Christ's likeness and sanctification, not knowingly sinning by condoning something that God condemns. Sorry, I have to make sure my 11-year-old's okay. Okay, from 1 Corinthians 6:9-11. Do you not know that the unrighteous will not inherit the kingdom of God? Do not be deceived. Neither fornicators, nor idolaters, nor adulterers, nor homosexualities, nor sodomites, nor thieves, nor covetous, nor drunkards, nor revilers, nor extortioners will inherit the kingdom of God. And such were some of you. But you were washed, but you were sanctified, but you were justified in the name of the Lord Jesus and by the Spirit of our God. It's a good reminder in that verse that such were some of us. We're all sinners without the saving grace of Jesus, who washes, sanctifies, and justifies us to our holy God. We're all sinners, yet whether that's being a drunkard, coveting, being prideful, self-focused, or being homosexual. We all need to repent and ask God to help us resist the temptation to sin, to grow in him and trust that he will help us. We need to love one another and bear each other's burdens from Galatians 6:2 as we help each other to turn from sin. Truly loving means to gently confront all sin, not accept it. So with that reminder that none of us are sinless, let's dive into more details about homosexuality to hear from God's word and medical stances on the subject. Satan's goals with homosexuality. First, Satan attacks identity. He strives to separate us from who we are made to be. From the beginning with Adam and Eve in Genesis 3:1, has God indeed said, and to verse 4, you will not surely die, for God knows that in the day you eat of it, your eyes will be opened, and you will be like God, knowing good and evil. All doubts and lies, we were already created in God's image and like him, yet Satan makes them think that God is holding out on them. In the end, Satan's thwarting of God's plan did make us know evil in this fallen world, something now we wish we didn't know. They didn't need to be like him because they were already created like him. And yet Satan played to the ultimate sin of us wanting to be God of ourselves, wanting our own ways and selfish desires, thinking we know best, questioning who we are, rather than trusting God and his sovereignty. From Proverbs 14:12, there is a way that seems right to a man, but its end is the way of death. Secondly, Satan distorts the definition of relationships. He wants to keep us out of relationship with God, so he attacks all elements related to relationships so that people will feel incompetent and afraid and reject their ultimate relationship with God. From John 10:10, the thief comes only to steal and kill and destroy. I came that they may have life and have it abundantly. I'm so thankful for Jesus and the abundant life that he gives. So where does homosexuality come from? We know homosexuality comes from sinful, selfish sexual desires and evil deviation from God's plan, but what does society say? One, they may say it's genetic, but from what I've read, there's no proof of a genetic link. In 1993, someone tried to think that perhaps on the XQ28 chromosome, that they were finding that in homosexuals, but then they only found it in 5% of homosexualities, and a later study disputed the findings anyway. Two, hormonal. There's been no proof of a hormonal link, and basically the theory is that if there's high testosterone in the womb, that would create a heterosexual male or a homosexual female. If there's low testosterone in the womb, that would cause a heterosexual female and homosexual male. Yet this is simply not shown. A simple example of this is with women with polycystic ovarian syndrome. These women have relatively higher testosterone levels compared with other women, and yet we do not see womb exposures to this causing homosexuality. There's biological origin, which points to genetic mutations, and unfortunately there are anomalies of biologic sex that's an outcome of consequence of the fall. We are in a sin-laden world that has led to diseases and malformations not intended in the Garden of Eden. Thus, there are mutations in genetics and embryology that leads to ambiguous genitalia. However, these are very, very rare by God's grace. In my embryology training in medical school, we were taught that in those rare occurrences of ambiguous genitalia, that most were to be made surgically into girls, since one can't as easily create external male genital anatomy. Thus, there are theoretically those boys who are genetically XY male, yet their sex organs did not appropriately develop, so they were surgically made into females. Yet, those embryologic mutations are exceedingly rare and do not invalidate God's design in creation for us to be made male and female. 4, environmental factors. Observational data has shown that homosexuality does come from environmental factors, such as traits of the parents raising the child and those exposed to abuse, unfortunately. So 1, developmental theory. They say that if there are instances in a home where the childhood mother was excessively loving with an emotionally absent father, it's more risky toward a homosexual male son, and mothers more loving, fathers more rejecting. 2nd, child abuse theory is that those who've been homosexually molested have a higher chance of becoming homosexual. Those with abuse and early sexual experiences, there's more of a risk of becoming homosexual. Peers, bullying, society. You know, there could be a child in school who had a great home life, wonderful parents, no abuse, but teased and bullied such that the core belief of who they are as an individual has been shaken. And I alluded to an example of this in my previous talk about one of my sons who was bullied for not wanting to look at pornographic magazines at school. He was accused of being homosexual by other boys. But thankfully, he felt comfortable discussing that with us at home so that we could affirm how God made him and assure him that he's not homosexual. So there's been no proof that I've seen to support the widely accepted cultural position that homosexual people are born that way. Most homosexual persons are not born with ambiguous genitalia. They are chromosomally male or female and have fully functioning sexual genitalia consistent with their genetic gender. So since studies have more proven that developmental factors in the home and the unfortunate exposure to sexual abuse as well as bullying has contributed to homosexuality, some have explained that homosexuality choice becomes a result of those difficulties. Dr. Carl Benzio in Today's Christian Doctor said, "Same-sex attraction or gender identity disorder is the paradigm they develop to manage and make sense of the hurts, wounds, traumas, distresses, and inaccurate data that they have accumulated in their lives with the intent of minimizing any further harm to themselves." Most of these strategies are not intentionally or pragmatically determined, but develop organically and unconsciously over several years or more, so the individual believes no overt or definitive conscious decision was ever made. Rather, it feels like a reflex, or even created design or wiring from as early as they can recall. This leads me to a question. If individuals are not truly born that way, and homosexuality is based more in subconsciously complex and difficult experiences in one's environment, can homosexuals change? And you won't find any recent studies about this because it's not politically correct. Because to try to change one's homosexual preference into being heterosexual, that would be changing someone that culture says they were born to be. Interestingly, though, studies done from 1960 to 1980, perhaps when homosexuality was not so widely accepted, studies were done to see whether homosexuals could change. And there was 50% reversal rates for homosexuals. And another study showed from 1930 to 1976 a 35% reversal rate. And obviously, we're not going to have 100% reversal rates of homosexuals changing, since homosexuality is a complex mix of environmental factors. But these studies contradict the thought that change is impossible. Additional arguments to suggest that homosexuality is not inborn is that so many homosexuals also have heterosexual relationships and claim to be bisexual. Of the statistics I read, two-thirds of lesbians also have sex with men, and only 20% of gay only have sex solely with men. So obviously they're not born that way if they're choosing to have sex with both men and women. Also from God's word, we know who they're created to be, and from 1 Corinthians 6, 9 through 11, the "such were some of you" indicates change is possible. Homosexual adoption of children. Before we leave the topic of homosexuality, I want to briefly discuss a very difficult topic that you as pastors and counselors may face, and that is homosexual families. These scenarios are thrown in our face with TV shows normalizing new definitions of family and with cultural acceptance. There's more and more exposure to these types of families. I recently went to a medical conference and I met a male attendee. Is a male physician who's gay, married to his gay partner, and together they're raising a daughter who's now 5. And from the world's perspective, I'm sure it seems that this young girl would have every opportunity for an excellent upbringing. One of her dads is a caring and successful physician, and her other dad similarly has a good job and provides for the family financially. But what about a female influence on this poor little girl? Who's going to relate to her when she starts her menses and truly understand all the aspects of being an XX chromosomally genetically true girl? Besides those simple questions, however, in my research for this conference, I ran across very difficult statistics that were hard to get my head around in regards to thinking of homosexual couples raising children. There's a higher pedophilia rate in homosexuals. 25% of gay men have had sex with boys younger than 16. There's higher domestic violence rates. Lesbians report sexual abuse. They report 90% verbal abuse, 31% physical abuse. 39% of men having sex with men report abuse. And granted, heterosexual families are not immune to the risks of sexual, verbal, and physical abuse. And many homosexual homes may be good homes. But if one had to choose, why not choose what inherently seems to be the best choice? In comparing homosexual homes and broken heterosexual homes, Focus on the Family's social research analyst Larry Berthoff, PhD, said, if the criticism is raised that points to the dysfunctionality and negative social consequences that characterize many traditional families, the point needs to be acknowledged as true, but actually irrelevant. It is neither logical nor helpful to use the worst-case scenarios to prove a point. We must ask, in regard to the raising of children, what is the potential of the best heterosexual relationships as compared with the best possible homosexual relationships? It should be patently obvious, even apart from the findings of current research, that the benefit to children of the natural family as a social institution far exceeds the value of any artificial homosexual family. If nothing else, the traditional family structure reflects and prepares children for the basic male-female diversity of human society. Transgenderism, gender definition. It used to be genetically determined based on how God created an individual. Now the definition emphasizes identity other than one's biological sex, a sense of self based on subjective feelings and desires, or identifying more strongly with the opposite sex or combination of male-female. Princeton professor Robert P. George was quoted in an article I read, and he said, "Do not identify yourself with your desires. Letting desires define us is the most abject form of slavery. Self-mastery is true freedom." So even a professor at a secular university can reason that we get into trouble when we give in to our desires. Slavery. Yes, slavery to sin. We know that self-mastery is not true freedom, but that Jesus Christ paying for sin on our behalf makes us free. From John 8:34 and 36, Jesus answered them, "More assuredly, I say to you, whoever commits sin is a slave of sin. Therefore, if the Son makes you free, you shall be free indeed." Again, sin is sin, and although transgender and gender identity issues are so pervasive in today's culture and may shock us, it's no surprise to God. Even this type of sin has been around since the beginning. From Deuteronomy 22:5, "A woman shall not wear anything that pertains to a man, nor shall a man put on a woman's garment, for all who do so are an abomination to the Lord your God." And this is not simply related to dresses, since men in that era often wore robes and skirts, but it speaks to the deeper issue of attempting sexual change. Deuteronomy 23:1, "He who is emasculated by crushing or mutilation shall not enter the congregation of the Lord." So unfortunately, transgenderism occurs when a psychospiritual problem begins looking for a physical solution. Gender dysphoria in children is a growing concern beyond the transgender movement in adults. Just like everything else in society, as adults wrestle with these difficult issues, it starts to trickle down to children whose innocence is taken away. Kids are bombarded by the media. Parents are told that transgenderism is normal, so kids start to then struggle with these same issues as adults. Parents can get caught up into letting their children dictate their own gender rather than living as the gender they were born with. And one study showed that 80 to 95% of these children will grow out of feelings and ultimately embrace their biological gender. Another study observed that less than 25% continue to experience gender dysphoria into adulthood. And this is no surprise, as it's normal in young childhood for girls to be tomboys, like football, boys to be sensitive and caring. It doesn't mean they should be the opposite gender. It's a normal development and part of the fearfully and wonderfully part of being made and God's creativity and how he makes us all with individual personalities. Yet with society's pressures and labels, now if kids are bullied, they'll claim it's because of sexuality. And unfortunately, there was a recent report of a 9-year-old claiming that he was being bullied because he's homosexual. First off, a 9-year-old is not anything sexual, has not even gone through puberty, and yet he's labeling himself as homosexual. Sexuality used to be a verb, an action or behavior of something someone does. Now sexuality is a noun, an identity of who someone is, even children who haven't even developed sexual hormones and maturation. Sexuality should be what you do, not who you are. And this is so pervasive that my 13-year-old daughter went to a Christian camp this summer, and a fellow cabin mate claimed to be bisexual. It's frightening to think of how this girl came to this conclusion, but it could have been through simple and innocent means. My grandmother used to relay stories to me of times when she would spend time with her quote-unquote girlfriends, going shopping and holding hands as they happily strolled down the street. They were innocent chums, and they would talk about boys they had secret crushes on, and she could enjoy these close friendships with other gals. Yet in today's society, that could be looked upon as being bisexual. If you want to be close and spend time with a person of the same gender and yet still be attracted to the opposite gender, you must be bi. That's really concerning to me as a mother to think of that girl in my daughter's cabin. I want to show the love of Christ. She obviously needed the Lord. Yet do I have to worry that if my daughter befriended her, that the girl may misunderstand and show inappropriate affections toward my daughter? This gives us pause for thought of the issues our younger generation are facing. Gender affirmation therapy. This is the world's way of dealing with gender dysphoria. The parent, physician, or therapist affirms whatever gender the child prefers, rather than helping the gender dysmorphic child accept their biologic gender. Parents don't parent, and they're giving into this. We say no to other difficult and dangerous things in childhood. We don't let 8-year-olds drive, drink alcohol, or smoke, yet we'll let them determine their gender. We say no to certain prescriptions. We don't want the risk side effects. Yet parents will say yes to unproven and dangerous hormonal treatments. Parents need to say no and not give in to societal agendas and pressures. Gender affirmation leads to transgenderism, which are actual treatments to change the body into the chosen gender. So transgenderism, puberty suppression treatment. What is it? At age 9, kids are given puberty suppression treatments. In boys, their testicles and penises will not mature. They'll have less muscle mass and narrower shoulders. Girls, breasts will not develop, and both girls and boys will not experience the typical adolescent growth spurts. Then secondly, cross-sex hormonal treatment. At age 16, they're given cross-sex hormones. None of these treatments are proven. They're not approved by the FDA, despite being mandated by the HHS, U.S. Department of Health and Human Services. These treatments are being passed off as being reversible, but that is not true, especially once surgery's been performed. And it's uncharted territory with no history of experience for generations, yet it's being purported as safe. There are inherent risks with cross-hormone treatments. If you give estrogen to males, you're going to increase that male's risk of life-threatening blood clots to the legs and lungs, increased risk of stroke and certain types of cancer. If you give testosterone to females, there's going to be increased cholesterol levels, which will increase their risk of heart attacks, strokes, peripheral vascular disease, increased risks of liver disease, increased risks of osteoporosis when you're eliminating estrogen. So these treatments are being purported as being the most healthy and loving option for kids with gender dysphoria. Yet Johns Hopkins experts and others have concluded that research, statistics, studies, and results do not support the method of treatment and therapy. The HHS mandated in 2016 that healthcare professionals must perform gender transition procedures on any child referred by a mental health professional, even if the physician believes treatment or hormone treatment could harm the child. Yet HHS's own medical board refuses to have Medicare and Medicaid pay for these treatments because of the risks and being unproven. So it's frightening to me to think that social agendas have a higher priority than medical risks. And this seems all too familiar and reflective of what physicians were forced to do in Nazi Germany. Thankfully, Christian Medical Dental Association and individual states have been fighting this national government mandate with rights of conscience legislation. So the purpose of puberty suppression and cross-hormone treatment, theoretically, it's supposed to heal mental anguish, depression, suicidality that comes from gender dysphoria. Yet those who follow through with transgender treatments have a 41% suicidality rate compared with 4.6% for the general population. Those who go beyond hormonal treatments and have permanent gender-transforming surgeries such as hysterectomies are 19 times more likely to die of suicide. They realize it's permanent and cannot be reversed and become hopeless. Parents see their child with gender dysphoria having emotional difficulties, mental anguish, so the parents think they're being affirming and loving by affirming gender choice. They think their child's depression and self-harm behaviors will improve if they give in to hormonal treatments and surgeries. Yet from statistics, it only makes the child at more risk for suicide. It may be seemingly a successful transformation at first, but statistics don't bear that out in the long run. And this is all relatively new, so parents say, oh, it's so much better to see my child happy with their new gender. They're no longer suicidal. Yet how long is that going to last? If 41% are suicidal based on statistics thus far, how is that really going to be successful in the big picture? Rather than putting energy and investment into parenting children, as in the image of God and how He made them, energy is being wasted with efforts that are futile. And it's no surprise for us as Christians, God's ways are always better, yet the foolishness of man to think that His ways are right continue to deceive. From Colossians 2:8, beware lest anyone cheat you through philosophy and empty deceit, according to the tradition of men, according to the basic principles of the world, and not according to Christ. Society says that the tragic mental health outcomes of suicide are due to society discrimination and stigmatization, yet we know that the outcomes are a result of sin. From Romans 1, as I read earlier, these gender-confused people are given over to themselves, to a debased mind, with no hope of quality of life since they don't have the Lord in their life. They listen to the original lie of, has God indeed said? And they think God is holding out on them. They refuse to surrender to His lordship and who He made them to be. They're ultimately steeped in sin, confusion, and guilt, and thus hopeless. They see death as the only way out. But we obviously need compassion for these. They are dying without a saving knowledge of Jesus, and they will not see the respite they seek, but instead eternal judgment and separation from God. Our hearts need to break for these in society. We need to show them love, show them Jesus who died on their behalf, Jesus who loves them and wants a relationship with them. Our identity should be in Christ, not in our gender. We are loved by God and wonderfully made. Some are more athletic, some are more sensitive or fashion conscious. This does not mean homosexual or in the wrong body. So we need to embrace those gifts and unique traits that the Lord gives each person and not push people into society's boxes of labels. In all these worldly sexual practices that we've discussed, we need to love the person, not the sin. We don't condemn and show hatred and violence, but show the love of Christ and that God's intended purpose and practice of sexuality is beautiful. And always remember that it's only by God's grace that we do not struggle with the same sin. So from Ephesians 2, 1 through 5, and you He made alive who were dead in trespasses and sins. And he goes on to say, in which you once walked according to the course of this world, according to the prince of the power of the air, the spirit who now works in the sons of disobedience, among whom also we once conducted ourselves in the lusts of our flesh, fulfilling the desires of the flesh and of the mind, and were by nature children of wrath, just as the others. And picking up again, but God, who is rich in mercy, because of His great love with which He loved us, even when we were dead in trespasses, made us alive together with Christ. By grace you have been saved. And that is it. So thank you very much. We're out a little bit early for dinner. If anybody has questions, I'd be happy to answer those to the best of my ability. I'm not an expert, but just things I've seen. Yes?
Do you see people coming into your practice who are struggling with that and having even asking you to help them?
Yes. I practice here in Bozeman, but with technology and social media, we're seeing more of the big city influences here in Bozeman, where people are finding other like-minded support and friends and People from the bigger cities are moving here to get married to a same-sex partner, or those who are struggling with gender dysphoria and considering cross-hormone treatments. They're getting support from their friends in New York City, and then they come into me as a doctor and want me to participate in that. And my stance is, I want to love them. I want to help them through their depression. I want to walk through the valley with them and help them. But I also want to make sure they know of the real risks associated with it, what they're considering doing. And at the end of the day, I tell them I'm not qualified and I don't feel right in helping them with that, because I took an oath, the Hippocratic Oath, to do no harm. And I'm just honest with them that I think this would harm them. And I don't have a ton of experience in treating this, because I don't, but I have a lot of experience as a female physician taking care of females who lose their estrogen. They're miserable. They get hot flashes, don't sleep, miserable with osteoporosis, all kinds of different things. They get more emotional and become sometimes suicidal just from going through menopause. And so somebody who's young is going to purposefully go through that. So I talk about the things I do see with hormones. I have to think how amazingly wonderful hormones would have been in the Garden of Eden. But ever since the fall, hormones are whacked. They're messed up. And, guys losing their testosterone, women going through menopause, postpartum depression, at every change of hormonal change in life, people are susceptible to severe depression and sleeplessness and all kinds of troubles. Why would you purposefully want to put yourself through that? Makes no medical sense. Don't have to follow God's way to see that it makes no medical sense. Any other questions? Yes.
Are there any statistics on what percentage of our population is homosexual or transgender? And if that population is growing?
I think it's definitely growing. And unfortunately, I don't have a recent statistic. In preparing for my previous talk, I came across data that said only 5% of kids are identifying as homosexual or transgender or bisexual or non-gender or whatever. And yet our society and media makes it sound like 95% of them are struggling with this. So I think it is still a small proportion, but it's growing by leaps and bounds would be my observation, especially, again, with media issues and the support. I mean, I've practiced here in Bozeman for 16 years. Early in my career, I never had these issues. And now, just in the last year, it's exploded. So.
This is more of a comment, but we were talking to someone earlier today in the hallway, and she was saying that her daughter-in-law is a teacher in a preschool class, 4 to 5 kindergarten classes in a public school in Minneapolis. And she said that there are several parents in the class who are, like you just said, want their children to not be pushed into one gender or the other. So they are insisting that the teachers don't direct them to the right bathroom on any given day. Those children have to be given the opportunity to choose whichever bathroom they want to go in. And they're not allowed anymore in that classroom to call them boys or girls. They have to find, and she says, what do you call them? And how can you teach like that?
And this is where we have to battle so hard, and we have to affirm what we know from God's word in the home. And so I just feel like we have to communicate with our kids. And it's so sad that their innocence has to be taken away, but we have to show our kids the verses in Leviticus, and that this is no surprise to God. This has been around since the beginning, Sodom and Gomorrah, and yet God is still in control of all of this. And even though the world is bombarding them with all these conflicting messages, we have to help our kids' hearts and help them to navigate that despite the world just going crazy with opposition. So it's going to be increasingly hard for parents when your kid goes to school and they can't even call themselves a boy or a girl and go into the right bathroom. It's pretty crazy. But hopefully with affirmations at home and God's word speaks better than our words. And I know so many times with my own kids, I could speak till I was blue in the face. But if I opened up the word and said, look right here, God knows, he's in control. He knew this was going to happen. This is no surprise to him. They can trust in his control of all of this. Yeah.
Do you think that it's going to be a time when you be forced
I'm already forced, according to the 2016 mandate under the Obama administration by the HHS. It says that if I deny or don't perform any of these procedures, I could have my license taken away. But I'm thankful for the Christian Medical Dental Association, an amazing national group who works on behalf of Christian physicians and dentists in these ethical issues to stop the absurdity. So they have done some rights of conscience legislation in the last 2 years, which have been successful. And another example of, I may lose my license, but I answer to the Lord. And I have to trust He'll protect me even if I can't make an income as a doctor, I guess. Yeah. Anybody else?
It's going to be interesting, let's say 10 years from now, 15 years from now, when all, we start reaping the whirlwind and all these health issues start popping up epidemically.
Absolutely. Yeah, I mean, when you have teenagers who are this tall because we suppressed their natural puberty growth development, I mean, this is going to be crazy. Mm-hmm.
A quick question, I don't know if you can answer it. Based on statistic, you talked about just the world's study of a homosexual changing. Was that based solely on the fact that the person said, I don't feel this way anymore? Or is there actual scientific research to show that there's actually a physical element to their changing? If they're saying that they're changing, or that they were born that way and they changed, then wouldn't something physical change? Or is that not a basis for?
Well,
You know what I'm saying?
I think we know from God's word they weren't born that way.
But the world would say they were.
Right, right.
So when they changed, what are they attributing that to?
I think they have a heart change and a mental change. There isn't anything that changes in their chromosomes or their hormones or whatever. And yet, I don't have the details of those studies. And again, you're not going to find recent studies because it's not politically correct. So I don't have the details of what those studies were, but I guess it was just kind of validating to have that proof that we know in God's word that nothing's impossible with God and that hearts can change. All of us have had changed hearts who trust in the Lord Jesus as Savior. We were all deceitfully wicked with hearts that were desperate without the Lord, but it's a miracle in our own hearts that we can change. And the same for them. But I don't think there's anything physical that changes in them. Yeah.
The medical world attributed it physical.
Yeah. I think, the medical world now just says you can't change because you were born that way. Well, back in the 30s to the 80s, they didn't necessarily say they were born that way.